Hello everyone and welcome to my channel. My name is Maria and on my channel I create videos around nursing. I also have a handful of lifestyle content. I am trying to get to 10k subscribers, so I'd really appreciate it if you guys subscribe to my channel and also if you gave this video a like. Not only does it help with the growth of my channel, it also tells YouTube that you guys would like to see more videos like this. This video is in partnership with www.nursingpersonalstatement.co.uk, so make sure you check that website out. It is such a fantastic, honestly guys, it is a fantastic resource. Anyway, in this video, I'm going to be answering questions in regards to your nursing school interview. A lot of you watching this video right now may have watched this video, and this video is the most, or one of the most popular videos on my channel. So I thought I'm going to go through the comment section of that video and basically just answer the most frequently asked questions so that you guys are in a better position when it comes to attending your nursing school interview, whether that's you going to university, which is unlikely at this time in life because of the pandemic, or whether it's you having your online nursing school interview. Right off the bat, one of the questions that I've been asked the most on that channel is, will I have a calculator during my numeracy test, during my drug calculation test? Do they give you a calculator? How hard are the questions? I want to say that when I went for my nursing school interviews, it was like 50-50. Some of them gave us calculators to use and others didn't give us calculators to use. I was under the impression that if they didn't give us a calculator, then the drug calculation questions would be easier. That isn't the case. From my experience as a student nurse and also from my experience as a registered nurse, whether you're given a calculator or not, from what I've seen, it doesn't dictate how hard the questions are. So make sure you brush up on your multiplication, on your division. Make sure you're able to multiply and divide between at least maybe two, maybe even at least two decimal places, and also make sure you brush up on conversions. So my rule of thumb is being able to calculate anything comfortably from a microgram all the way through to a ton. Not that it will be working in tons, but I think that is good to know. So that's a very frequently asked question. That's a question that I've been asked frequently. So I've got my laptop with me, so if you see me looking down, it's because I want to make sure that I read the questions that you guys have been asked me word for word in regards to your nursing school interview. Another question that I've been asked quite frequently is in regards to ethical questions. Somebody's asked me, thanks for applying, however, do you have an example of an ethical situation, please, just for better understanding? There are so many different examples of ethical, questions based around, the ethics of nursing or the ethics of healthcare. The first thing that comes to mind is, what are your thoughts on, euthanasia? Rate the 3 most popular and discuss in detail. That could be a question that you're asked in your interview, your individual interview, or a question that you're asked during your group interview. What I found is that ethical questions tend to be presented in the group discussion. And don't think that just because your interview is online that you're only going to have an individual interview. Some universities online, they're conducting an individual interview and they're also conducting group interviews, because with Microsoft Teams, with Zoom, with Skype and all the other software, it is possible to have multiple people on a web chat. So yeah, that's a very simple example of an ethical question. When I think of my practice, for those of you guys who don't know, I've been a registered nurse for 2 years. Another ethical situation that comes up quite frequently in my practice is we have a patient who's in the hospital, and they've said, I only want you guys to relay information to my first daughter. However, I don't want you to give any information to my son if he calls. I don't want you to give any information to my wife if she calls, only to my first daughter. She's the only one that I want to have that I want you guys to share confidential information with, whether that's on the phone, through email, or if she comes into the hospital. And then, you've got the patient's wife calling, shouting down the phone, asks for information, saying, this is my husband. And then you've got the uncle from Australia, and then you've got, the eldest son from Italy calling. That's an ethical situation. What do you do in that situation? Do you give them the information even though the patient has told you not to, or do you not give them the information? And yeah, this is a situation that I myself have experienced several times. And sometimes they will even come into the hospital demanding information, even though the patient has clearly said to you that they don't want you to give X amount of people or X type of person any information. So yeah, that's an ethical situation. Patient has condition X, 3 different treatment options for people with that condition. However, we know that nursing healthcare is not a one size fits all. Just because patient has condition X doesn't mean any of the 3 treatment options will work. And we know that for this patient, none of the 3 treatment options will work. Like they will not work at all. They will probably have a negative impact on his life moving forward, and it isn't gonna, you know, improve the quality of his life. But the patient doesn't understand it. He's been on Google, he's been on, I don't know, I was gonna say Instagram, but people don't go Instagram for medical information. He's got a cousin in America who's a consultant at one of the top, you know, renal hospitals, and you know, they're saying these are the treatment options. But because we have assessed the patient, we know that, you know, I'm really sorry sir or ma'am, but none of these treatment options are going to work. However, we do have an alternative treatment. So an ethical dilemma for that could be, no, you don't think it's going to work. You and, you know, members of the multidisciplinary team do not believe it's going to work, but the patient is still pushing. That's another ethical situation. What do you do, and what points and thoughts are you going to bring to the discussion? Again, like I've said, because in real life situations like this, you're not just going to tackle it alone by yourself. Chances are you'll be talking with the doctors, the physiotherapists, the social care workers. You'll be talking with members of the multidisciplinary team. And during your interview, the person who is interviewing you, or the course leader, or the person who's organizing, you know, the interview process, they try and make the situations and the question that you are asked mirror what may happen in real life. So like I said earlier, ethical questions tend to come up in group interviews and in group discussions, but at the same time, don't think that during your nursing interview that they're not going to allude to any ethical dilemma. So I hope that wasn't a long-winded question, but I'm the sort of person where, like, I feel like there's no point doing a video if I'm just going to touch upon it on the surface. I want to go into a reasonable amount of depth. So like I said, depth. So like I said, if you are liking this video, give it a thumbs up, and if you want to see more videos like this, also make sure you subscribe to my channel. I am trying to get to 10k subscribers, and I would really appreciate it. So someone's commented saying, I'm supposed to have another interview on Monday, but I didn't hear from them, ... So I think I might have ruined it. I've commented saying, give it some time. Guys, give it some time. Don't think that if you've had an interview on Monday, that by Monday evening or by even the next Monday that you're going to hear from them. Make sure you give it some time. I know that with my interviews, the university that I actually ended up going to, before I even got back on the train to get home, I got a call saying that, you know, I'd been given an interview place. And I think one of the main reasons for that is, one, because, you know, obviously I did what I had to do, but I think another reason for that is because I actually got my nursing place through clearing. So obviously through clearing, there's a limited amount of time. They want to, you know, they want to speed up the process and get to where they need to get to quicker. And that was actually one of my concerns during the interview. And a couple of you know, prospective nursing students, including myself at the time, also had that concern. We were like, okay, if we submit our application right at the beginning of the cycle in comparison to if we submit our application right at the end of the cycle, does that improve our chances? Because we were under the impression that we don't just want to be given a place just because, you know, the cycle's nearly over. And at the same time, if we had, you know, applied, you know, a lot earlier on in the process, again, we don't want to lose a place because you're thinking, oh, actually, we've got 100 places. We don't want to give all our places out in January because there may be more people applying later on in the year. So that is a concern. And the response from the admissions, what's his name? Admissions recruitment nursing guy, he was absolutely amazing. And yeah, he's amazing. He was absolutely amazing. And he basically said that, no, that isn't how it works. Because I got my place through clearing, I asked him, this is such a good university, why is it coming through clearing? And he's basically said that the NHS or someone has given the university extra money, meaning that before they could only recruit X amount of nursing students, but now they can recruit an additional 10 nursing students, hence why this is the first time that this course has ever gone into clearing. And then, you know, me, I think it was me or no, it was, I think somebody else must have said, okay, then if you've got 10 extra places, why didn't you just go back to the people that you've interviewed earlier on in the process? And he said that, no, all the nurses that we've interviewed earlier on in the process, all the ones that met the criteria, we gave them a place, and all the ones who sort of met the criteria and all the ones who didn't meet the criteria, we did not give them a place, and we did not give them a place for a reason. It wasn't due to nursing numbers, it was just due to our criteria. So, like I said, going back to the comment that she made, don't think that just because you don't hear from them straight away that you are not going to get a place. Don't think that you've been unsuccessful. Just give it some time. Sometimes it can take 1 month, 2 months down the line before they actually offer you a place, and that's due to a whole bunch of reasons. One of them for which I mentioned, and a whole bunch of reasons that, you know, some of us may never really understand. So someone's commented saying international students who are pursuing masters in nursing UK must go for CBT and OSCE exam. It's a yes and no, it really depends. I'm assuming that if you are an international like I said, it really depends, yes or no. If you're an international student and you want to go for your masters, I'm assuming you already have your diploma in nursing or your degree in nursing from your home country or even from the UK. If that's the case and you're already practicing as a nurse, then you will not need to do your OSCE exam. However, if you're coming from, let's just say, India or the Philippines, and you already have your diploma in nursing there and you want to come to the UK and do a master's in nursing straight away, it really depends, because not all masters in nursing are the same. You've got the undergraduate masters, which I did. You have the postgraduate masters. Some masters in nursing are clinically based, meaning that you're, you know, using your hands, you're, you know, in the hospital actively working with patients. And then you have others that are not clinically based. They may be based more upon research, so doing a CBT or an OSCE may not be relevant. With questions like this, I always say make sure you go to the educational institution that you're interested in, because a lot of the big universities do have, you know, not just a recruitment hub, but they also have recruitment hubs for international students. So always go there, because with international students, it really is a case-by-case basis. Primarily because the funding for international students is completely different from students who are in the UK. I'm not sure if I can say EU anymore, but who are in the UK, who are in the EU, Switzerland and Liechtenstein and all of those. Someone has asked, what type of questions are asked in the entrance exam? I'm not really sure what you mean by that, because entrance exam is different from interviews, but during your nursing school interview, we'll just say interview selection day as a whole, generally what you'll have an individual interview, you may have a group interview, and then chances are you'll also have a numeracy drug calculation test, and then some universities will also do an English test, as well. When I say about the English test, it isn't a test to test your level of English. It's not like an IELTS test. The English test, from what I've seen, you know, when I was, you know, doing my nursing school interviews, it tends to be things like care plans and planning, and, you know, maybe using acronyms like ADPI and all of that stuff. So that's what I mean by the English test. I do have loads of videos on my channel that talk about you know, basic job calculations for not just registered nurses, but also for people like you who are watching a video who would like to be admitted onto a university, or who would like to be admitted onto a nursing degree or nursing apprenticeship program. Oh, actually, entrance exam. I think maybe she might be pointing at, you see how medical students have the UCAT and I believe the MedCat? For nursing, we don't have that. There's no sort of national exam that you have to do, which I guess kind of points at one of the, I don't know, you could say it's a weakness of the nursing profession in the UK. I don't know, but yeah, we're not like medical students where you have to do like a MedCat or a UCAT exam. However, individual universities will set their own standards, but best believe that the standards that they're set in terms of entrance exams and drug tests and stuff, best believe a lot of it, or all of it, will be based upon the NMC, the Nursing and Midwifery Code. So if you're not aware of it, then, you know, make sure you get to grips with what the NMC code is. You don't need to, you know, write paragraphs about it, but it is a good idea to know what the NMC is. It is a good idea to kind of quickly flick through the NMC code. If you want me to do a video about the NMC code, then I can definitely do that. Someone else has commented saying, "Hi Maria, I just stumbled across your video. I've been accepted into adult nursing, but find it difficult to choose the right university to go to." And she said, Wolverhampton, West London, and Anglia Ruskin, what's your advice? And I've commented back saying, hey X, this isn't a straightforward question, you know, contact me here. And it isn't a straightforward question. If you do have any personalized questions, then you can go over to Nursing Personal Statement, www.nursingpersonalstatement.co.uk, and I'll try and answer your question. Do you know what, like, I know the answer to this question. Well, I know one university that she certainly should not go to, but you know, obviously this is a public forum. I can't just come on here saying these are 5 universities that I would not recommend anyone to go to for nursing school. So fingers crossed she has chosen the right option. I think she did contact me on Instagram or Snapchat, and I told her this is it, like there's one uni that you listed on there that I would not recommend for anyone to go. But this is actually just like another video idea. Maybe I should do a video talking about how to really choose the best university for you. Because a lot of times people think, oh, I'm just going to go to university with the highest ranking. Just because they've got the highest ranking doesn't mean you're going to get the highest grades. Let's be real. Just because they've got the lowest ranking doesn't mean you're going to get the lowest grades. But to come off a question about what university to choose, my advice, one of my friends actually recently just got accepted onto several nursing programs, and she picked a certain university, and then she told me what other options she had, and I was like, yes, that is perfect. What I would say when it comes to university, looking back now, I would say location. Honestly guys, like, don't be thinking this is Russell Group, this is Metropolitan, this university is old, this university is more recently new. Like, location. That would be my biggest advice. If you want to, you know, go away to uni, if you want to be on the other side of the UK, then that's fine. But if you're the sort of person who would rather stay in the local area, I don't mean still stay in your home. If that's what you want to do, then definitely go for it. But I'd say location is the biggest key. And when you go for your interviews, one question that you can ask them is, where are the placements located? Because I know that for the university that I went to, the placements were located like literally everywhere. They were everywhere, which made for a varied experience. But I know that there are some universities who only work with a certain amount of hospitals. So I know that if I go to University A, these are the hospitals that I will be going to for placement. The commute is easy. If I go to University B, these are literally the hospitals that I'm going to. And if I go to University C, the hospitals that I'll be based at placement are quite close. So make sure you keep that in mind. Location is very important. Another thing that I want to say that you should consider when choosing your university is also money. Money. Like my mum would always say, cut your cloth according to your size. If you don't have money, if you do not have enough money, then there is absolutely no point saying, I'm going to travel to the other side of the world where I've got to pay ridiculous amounts of money for accommodation, when you can literally just go to a university in a different location where the living costs are generally lower. So yeah, if you are strapped for cash, I'll say try and stay in your local area. Maybe you can still stay at your parents' house or wherever that you're staying at, because generally that will be cheaper. Where you're at right now will be cheaper than going to, you know, a university, you know, down the line. You don't want to come out, well maybe you do, but you don't want to come out of university with loads of debt. Slowly, the UK educational system will be becoming like the American educational system, and that's literally facts. Not just in terms of how it's run, but also in terms of how much you are charged. Right now, I believe people are being charged anything from £9,000 to £10,000 a year. Put that on top of accommodation, on top of food, on top of maintenance costs. Like, there's a lot to consider. Someone else has commented saying, hello, do you think it's possible to work while being in nursing degree? Thanks for your attention. Yes, definitely. I do 100% believe that it is possible to work a part-time job while on your nursing degree. During 70% of my nursing degree, I was working part-time. Anything from waitressing to working in retail to volunteering. Best believe, been there, and I have done that. I would definitely recommend it. For the first 2.5 years or 3 years, placements were blocked. So we had a block of placements, a block of theory, a block of placements. And I knew that generally during the block of theory, I could do I could work more shifts, I could do more overtime. Anyway, I think that is it for this video. Like I said, I am trying to get to 10k subscribers, so I'd really appreciate it if you subscribe to my channel, and also make sure you give this video a like. If you do have any questions and you want me to do another Q&A in regards to your nursing school interview, your nursing day, you know, selection day, then make sure you put that in the comments box below. Thank you guys for watching, and I will see you guys in my next video. Bye.